Good afternoon and welcome. Thank you for joining us for our training, Tools for Creating Calm in Times of Distress, Part 5, hosted by the Center of Excellence for Behavioral Health in Nursing Facilities. I am Nikki Harris, Training and Education Lead for the Center of Excellence, and it is my pleasure to oversee the delivery of mental health and substance use disorder training to nursing facilities nationally at no cost to the nursing facility. And now I am happy to introduce our presenter for today, Mr. Matthew Rosa. Matt is a licensed clinical social worker, consultant, and founding member of NIATEX. Matt provides training, coaching, technical assistance, and planning support to universities, research studies, government, and health and human service provider organizations. Matt's current areas of focus includes evidence-based practice implementation, process quality improvement, staff and team development, and a wide array of training topics. I'll now turn it over to Matt to begin the presentation. Thank you.
Thank you, Nikki. Thank you, Derek. I appreciate that. And it's good to be here with all of you today. I hope you're all doing well. This is, as Nikki said, part 5 out of a total of 6. So we have one more in our scheduled sequence, which will be coming soon. So for today, we have a couple of learning objectives that we're going to focus on. We're going to explore some de-escalation strategies, some key tools. We introduce the idea of grounding and using oars, and we'll explain what those are in further detail. We introduced those previously, and now we're going to spend a little bit of time taking a bit of a deeper dive into those, and also exploring fixing reflexes and how to contain them. That's always kind of an interesting conversation, especially with folks who work in healthcare and helping fields, who tend to be folks who want to be helpful, want to be supportive. Of course, that's part of your mission for why you do the work that you do, and how this fixing reflex, this desire, this impulse to fix a situation may sometimes be counterproductive to your work, and how we manage that. So we'll spend some time exploring that today together. It's helpful, I think, to remind us where we have been focusing throughout this series. We're engaging individuals in the environments in which you're working within your facilities, and the individuals may have mental health care needs and may have challenges and distress that they experience. And sometimes there is a tendency to push forward to try to deliver care and supports, when in fact what we need to do is to take a bit of a detour to use tools that we have that will help us to actually save time and become more efficient in the work that we're doing. If we manage the distress effectively, we can work our way through those distressors, help them to diminish so that they aren't obstacles to care and other supports that you're trying to provide. So we want to take some time to think about grounding. I have a personal story around grounding. We all need grounding periodically. I was traveling at the beginning of this week on Monday and Tuesday, and there was a lot of intense weather out there in the world. I happened to be in the middle of quite a bit of it as I was traveling. So on Tuesday, I had to take a drive that was supposed to take 90 minutes. Some might argue it wasn't the best choice to make the drive. It took me 4 hours, creeping along, going very slow. And I was doing a lot of grounding exercises for myself. I was doing breathing exercises, kind of focusing on my physical environment to keep myself present, because it was quite an anxiety provoking drive. I was kind of talking out loud as a way of kind of keeping myself focused in my present safe space as I was driving under very challenging conditions. And then I ended up on a couple of flights to get home, and my second flight was a very turbulent flight. So turbulent that after the flight was over, I asked one of the flight attendants, on a scale of 10, 1 to 10, I usually try to be data driven, as you can understand from some of the stuff we've been doing together. I said, on a scale of 1 to 10, how turbulent was that flight? And she said, that was a 9. So that confirmed my experience of the flight, which was that it was extremely stressful because of the movement of the plane. And so again, I was doing some similar things. I was reading some material to keep myself focused in the present space. I was doing some breathing activity, breathing exercises, trying to remind myself that I'm in a safe space, that these planes are designed to stay in the air and to fly and to keep flying even under very challenging circumstances. So all of those things help to keep me centered and present. I did observe some different folks kind of feeling a bit of distress and was wondering what they may or may not have been doing to try to manage that distress. Not very much talking was happening. Sometimes people who are helpers of others will support each other in those moments. So I think it's important to think about how these grounding activities and exercises are helpful in your work environment. They're helpful in all of our environments, right? Everywhere we are with our own experiences of distress. So when we think about traumatic events, it's helpful for us not to say, was an event traumatic or not, as though it's a yes no question. More, it's what kind of stress did we experience? Was it traumatic at some level? I like to use those 10-point scales. I think it's helpful on a scale of 1 to 10. How dysregulated did I get emotionally as I was experiencing that distress? Um, and what do I need in order to maintain my level of focus and centeredness in order to be able to manage my circumstances? And how can you help residents with whom you're working to get to that space where they're able to move forward effectively? So, how do we get folks back to that present space and time? As I was getting ready to chat with you today, I started thinking about, I thought I might share that anecdote about that drive and about that flight. And I started to get focused on that drive again. And I found myself leaving this space, this room that I'm in right now, and really focusing on that past anxiety provoking event. This is what we all do. Right. So then I needed to bring myself back to the present in order to be present and focused with you. And then what kinds of cues did I need to do that? Breathing, eating, drinking, touching something, focusing in the room where I am, smelling something. Sometimes the things that we might be able to smell, aromas in the room, awareness of your body. As I was driving that drive, I had tried to focus on my awareness of myself driving the car and being very mindful and conscious of that. Um, I wasn't listening to music because I didn't want to distract myself. But if you're in an environment where you can do that, that can be a way of refocusing in your current environment. Um, so you can have that experience of being here, present right now. And I would love to hear in the chat when you think about those moments, like if you're driving and it's a very sort of challenging, distressing situation, or if you were in flying and it was a plane that was having a lot of turbulence, or if you were in an environment where there was something distressing of those sorts, which was pulling you away from your kind of present moment. What right now might you think that you would do, or what do you know you use as those recentering tools? Anybody feel free to place something in the chat about what you do if you're driving and it's highly stressful or sort of scary traffic situation. Um, so Kelly says, um, I appreciate Kelly's comment. Closing your eyes helps in times of turmoil, but not when you're driving. Thank you for that. Public safety announcement, Kelly, right on track. I agree. Um, and then Cameron saying, so the countdown, rolling down the window, cool air hits you. This is a really good example of using sensory stimuli, right? So, when you're rolling down that window, I've done that myself. That's a really nice one. You dramatically change the temperature, right? Suddenly change the temperature. If it's cold out, and you have your temperature at a comfortable level in the car, roll down the window, get that blast of cold air, and it pulls you right back into your present moment very clearly because you have that real strong sensory experience. Eating something sour, right? Putting on a good podcast, turn the radio off, tend to see better, praying, so different kind of meditation, prayer exercises. Um, so all of these, eating something sour is a good one. I think that's helpful. Sometimes I will do that too. People do that if they feel a little sleepy or groggy when they're driving as a safety precaution to keep their brain and their body activated and alert. I have this little strategy where if I have like some peanuts, I'll just put some peanuts in my mouth and I won't chew them. I'll just leave them there because it keeps you sort of focused and alert. It's sort of silly, but I find it very effective. Um, so different kinds of strategies that you all have, we all find them in different ways. Now, then when you think about how that translates into your work environment, how do you help people to get back into the present moment? Knowing that we have to be humble when we do this, and what works for us might not work for everyone, of course, might not work for the resident with whom we might be interacting, who might be struggling. I might know that for myself, if I have what appears to be a similar kind of distress to what they're experiencing, I know that certain things will help me to get back to the present moment, to the here and now, to know that I'm safe. As I was in that airplane saying, I'm here, I'm in this plane, it's a safe plane, it's perfectly fine, it's doing what it needs to do. The pilot's in control of this plane to stay centered and focused, right? So I had certain kinds of activities. Now, those are not the activities that would work for everybody. We all have to kind of find our own. So how do you help the people you're trying to support, the people you're trying to serve, to find what are theirs? Feel free to share something in the chat that you've done that you know has worked with the people who you're serving. Um, Something that maybe they've told you helps them or that you have suggested that they have tried. Um, Box breathing comes from Cameron. Um, Belly breathing, so different sort of meditative, kind of standard, typical meditative practices for how to do breathing. And those are great to experiment with the folks you're serving, is to teach them these techniques and then to see how it works for them, to have them try it and again to be humble in your representation of the idea for them to try and then to see how it works for them. Asking what do you use when you have anxiety issues? Yeah, so Darlene's saying that you can just simply ask people, what do you do if you're feeling anxious? I know for myself that self-talk is really critical, that I kind of coach myself through those moments. For example, if I'm driving and it's really difficult driving, I live in a pretty snowy place that tends to have periodic bad driving in the wintertime. I talk out loud to myself. I talk myself through if it's really challenging and slippery, and when my car starts slipping around, I say, "Okay, you got this. This is okay. All right, just be mindful of this. Okay, you're doing good." I will sort of have a little monologue to myself, and that really helps me to stay focused on the task, and it also calms me down quite a bit. Now, other people they might not find that to be helpful. Carrying a nice smelling lotion in their purse they can use when they're feeling anxious. Juliana shares that one. So something that would kind of refocus you in the present moment and also would be very pleasant. I think that's a good one. This is a great example of how different things work for different people. Um, Smells are pretty much useless for me. That doesn't help me at all. And one of the reasons why it doesn't help me is that I had some injuries resulted in breaking my nose a couple of times. And then corrections to my septum. I can't smell much of anything. So smells are not a impactful sensory experience for me. So that wouldn't have any use for me. But for other people, it's hugely impactful, very impactful of mood and of mindfulness and presence. So all of these different things that you can do, and think about the strategies that you can use as you pull people together, uh, as you're trying to support them when they are distressed. Think about how to humbly ask them some of these questions. Um, Cameron's talking about the I Spy game, I Spy game, finding shapes on the wall, colors on the walls. So these strategies to sort of distract from what might be the distress and focus on a simple activity of something that you can do, like play that game, finding a certain something. I think I've used that myself on occasion, trying to focus in on something. I think that simple reading, as I said, when I was on that airplane, I was reading and I was fully aware that things were kind of stressful in the space, but I thought, well, I'll just keep reading because focusing on this book will help me to not be quite as agitated about the environment that I'm in. And that worked for a while. But then after a while, I noticed that I wasn't really able to read. Frankly, the plane was moving too much for me to see what I was reading. So I said, well, that's not really helping anymore. So I put that reading material away. Finding these different places of focus and knowing that There's a wide array of possibilities. So we talked about, oh, someone else mentioned some different activities. 5, 4, 3, 2, 1 was mentioned, I think, in terms of just the using the different sensory inputs and going through the 5 senses. And we'll touch base on that one in a second. Darlene likes to look at the clouds while flying to see the shapes. I like to do that too. Yeah, if you're able to kind of look out the window and have that experience, I think that can be helpful too. So self-soothing strategies that you have. Um, what I'd like to do is take a 5-minute break. I want people to have a chat with each other. We've had a few people share a little bit here. I'd like us to do a quick 5-minute breakout. Uh, Derek's going to put us all into breakout rooms and just unmute yourself. In order to do the breakout, you need to unmute. And I'd like each of you to just take a minute and share something that you know that grounds you. We're sharing this because I want you to be appreciative of your own grounding activities so that you can be mindful and support others in their grounding activities. So we'll do a quick 5-minute breakout, and each of you hopefully have 4 or 5 per breakout. Do unmute yourself, and then you can each share something that you know works for you to help you to stay calm and present and feel safe in your current environment.
All right, I'm going to go ahead and create the rooms. There'll be about 6 people per room, and make sure you unmute yourself. You can keep your camera off. Just make sure you unmute yourself.
I hope you all had a chance to interact a little bit and hear from each other about some of the things that you do. That's a great source for ideas that give you empathy toward others with whom you're working, and also ideas that might work to try to support other people. Again, from a humble perspective, which is that what works for one person may not work for another person, but to use some of these different kinds of tools. Someone had mentioned earlier the 5, 4, 3, 2, 1 to center yourself. 5 things you can hear, 4 things you can see, 3 things you can touch, 2 things you can smell, 1 thing you can taste. To kind of work through to place yourself again back in your present moment. I'm in this space. I am safe in this space. To the degree we can learn that something is somewhat traumatic, we can, as we look back and think about something that has happened, does it pull us out of our awareness of our current space? Do we have a bit of a flashback experience? Do we have a daydream that pulls us away from our awareness in our current environment? Stressful and traumatic events do that to us. I was mentioning when I had with that drive. That was a very hard drive that I did that day with multiple opportunities for things to be really problematic. And so as I think about it, I start to leave the present moment and start to feel some of those stressful experiences. Now that will fade because it's not a severe trauma and it's a modest traumatic experience, which will resolve itself without any lasting impact on me. But more severe circumstances and challenges wouldn't maybe resolve without some additional supports and resources. We did mention before the idea of informal kinds of grounding. You can do exercises. You can do some of the things that you all were suggesting in the chat and that you were sharing with each other. You can also just find ways to engage people in an awareness. I call this the I like your hat category, which is just an observation of someone's presence, the physical environment in which we find ourselves that brings them into the room in the present moment. I find it can be disarming of some of those distresses. We have to do it with respect. Of course, if someone is very distressed, if we say, I like your hat, it can be perceived as a lack of empathy and a lack of appreciation for their distress. So we have to be careful about the context. But finding ways to notice things in the present with a proper acknowledgement of the distress that the person is experiencing is particularly important. I just did see a note around sharing screen. Are you folks still seeing my screen as accordingly as appropriately following our breakout? Give me a thumbs up on that, Derek. Are we good
No, we
or
actually,
not?
Yeah,
no.
you had to reshare your PowerPoint.
All right. Thank you very much for that. Appreciate that. Let's do that. All right, so we're back on, yes?
Yes.
Yes.
Thank you, appreciate that. So yeah, so there's different kinds of things like that that you can do that will help you. We had talked about ORs before, and I think if you use nothing else from the territory of motivational interviewing, you can use these ORs tools: open-ended questions, affirmations, reflections, and summaries, as a way to try to understand what might be occurring for someone as it relates to some kind of distress. Um, so ORS, it provides that acronym for us to think about these 4 elements. Open-ended questions, those are those why, how, what, tell me more kinds of questions, which create an expansive opportunity for responses. Affirming, appreciating someone, reflecting back to them what you're hearing, being a mirror to them, and then summarizing if someone shares several ideas, particularly when people are distressed, sharing. They may share things and have a hard time following their own sharing because they're experiencing a high level of distress. So you can help them to frame the story. So here's what I'm hearing you say, that this is happening and that this occurred and that that occurred and that this is why you're feeling some concerns and you're a little embarrassed about that, but you think that if you talk about it, it might help you. So I'm kind of summarizing the narrative or the story that was shared by the individual. Um, so think about, which kinds of open-ended questions you can use and how you can use them. What kinds of questions would be effective in response to certain kinds of common distress that you might be experiencing. Think about some distressing situations that might be regular occurrences for you in your workplace. You probably have some questions that you might use. Some people have some go-to open-ended questions like, how are you feeling today? Or what's going on with you right now? What's going on for you right now? Or uh, tell me a little bit more about your situation. These are open questions that allow the person to share a wide array of possible responses. Um, Feel free to use in the chat if you have questions that you like. I always find it helpful to share your open-ended questions. Feel free to share with each other in the chat. What sorts of open-ended questions do you use when you're finding that someone might be struggling and you're trying to engage them? You probably use some version of an open-ended question which might get them to share. So feel free as we're moving forward with our content to share something like that if you have a question that's a go-to question for you. Affirmations are particularly helpful. I find that when people are distressed, it can be really helpful to give them an affirmation. When you have an interaction with someone, and think about how you can frame things with an affirmation. I noticed that even though you're feeling quite distressed about the situation, you're still, quite pleasant and kind-hearted as we're talking about it. I appreciate that even though you disagree with some of these policies or rules, you're able to talk to me and have a healthy dialogue with me, even though it's something that you feel quite strongly about. It seems like you are able to get some support from people, and I think that's because you support them as well, so they appreciate you. So that's why you're able to have people helping you. I'm impressed that you're able to process through a lot of information here about something, even though you're kind of frustrated, and so that's impressive to me. So these affirmations can be quite disarming of certain kinds of distress, particularly if it's distress where there's sort of an interpersonal conflict that's occurring for someone. Again, we have to be mindful of not patronizing anyone, be mindful of the person's emotional state. If someone's very, very hostile or angry about something, if we say something that's sort of superficial to them, that's an affirmation like, you're really a good person, they might feel like we're patronizing them and not respecting their current distress or frustration. So we do have to be mindful of how we do that process. But the affirmations can be very powerful. I use them a lot in a lot of my work, and they really go a long way toward addressing different kinds of distress. Reflections, again, reflecting back what you're seeing, thinking about your experiences with people. I hear you telling me. Think about how you're listening. Strong listening, really powerful listening. I was in a meeting yesterday where someone was telling me something and I had to stop them and say, you know what? I was thinking at the same time as you were talking, so I was trying to think and listen at the same time, and so I missed the last thing that you said. They sort of gave me a little funny look, but what I'm doing when I'm saying that is I'm trying to really listen strongly and effectively, and I didn't quite get it done at that moment. So I owned that, and they, I think, really appreciated that because I was really giving them a clear message that strong listening is very important, and I wasn't quite getting it done at that moment. So say that again so I can make sure I understand it. That's where reflections are really a powerful way of you respecting and helping people to know that you are listening. I'm reflecting it back to you. And here's what I'm hearing you say is, am I understanding it? Do I have this right? This is important to me. I care about making sure that I understand you. And that in and of itself has a tremendous diminishing of distress under most circumstances. And the summaries are sort of a broader version of that. So these are the key things that I'm hearing. So this is the situation as I understand it. Um, um, so does that help? We want to make sure that we're careful about how we do that because the summarizing should be designed to kind of quiet things. We want to make sure that if the person has been laundry listing a lot of elements of their distress, that we don't say, okay, so I'm hearing that this is really hard for you, and this is really hard for you, and this is really hard for you, and this is really hard for you. That would not be a calming influence, right? We'd be kind of escalating or agitating if we framed it that way. We might then want to say, I hear that there are several things that are just that are challenging for you. You've said several of them, and here's what you're kind of dealing with right now. So finding a way to take a little bit of the edge off of it to make sure that we don't increase with our reflection the experience of distress or amplify it in any way. So this idea of fixing, let's sort of transition, take a few minutes to talk about this sort of fixing impulse that a lot of us have. Um, what should we try to fix the situation or not fix the situation? This idea of don't just do something, sit there, which is the flip of that usual idea. Maybe we need to just be present and to sit with some compassion, with strong empathy. Let's do a quick poll here. I want to ask you to look at these 6 situations. Which of the following situations would create a strong fix-it reaction? Like, I just got to fix this situation and make this go away and resolve this, and I feel a strong impulse to do that. So you can pick any of these that apply. Derek's going to pull up this poll for us. And so for the ones that apply to you, just check those and we'll see what we have from our audience. Let us know which of these create a strong desire to just kind of quick react, impulsive fix, let's get rid of this situation. Uh, let's see what we get from our responses today. And Derek, whenever we get to, a reasonable slowdown of responses, we can go ahead and share that poll response and see what we have.
10 more seconds.
Yeah, sounds good. So plug in any more if any of you want to share any further ideas with us. All right, so it's a pretty, thanks for sharing that, Derek. Thank you all for responding. Pretty interesting balance across all of them. I will tell you that I have a pretty strong fix-it impulse, so I get triggered by all of these things, and I have to sometimes, remind myself of what's the best course for me and for other parties in terms of what's actually helpful versus this kind of quick fix orientation. The one that got the most votes was the tie, removing pain from one who's hurting. soothing someone who is fearful or anxious. That kind of makes sense. Those are the most maybe vulnerable presentations. When folks are angry, that's a little bit less vulnerable. But the one that got the lowest number was connecting with someone who is lonely. That might be a little bit less overt and obvious when you see loneliness. I'll tell you where I used to have that one is when I used to do some teaching on a university campus, and I would sometimes see students walking by themselves looking maybe a little lost or a little sad, and would have a really strong impulse to just kind of go up to them and check on them and see how they were doing, because they just looked like they might be struggling, or maybe looked like they might be disconnected socially. Now, that's kind of a projection on my part. I have no idea if that was accurate or not, so I'm just using some cues, but I'm not sure it was reality. So we do again have to be mindful of our own projections in these situations. Just because we see a situation that we think is a certain kind of distress or challenge doesn't mean that it actually is that. So we have to make further inquiries. So a lot of you acknowledge that you have several areas where you do have vulnerabilities to trying to kind of impulsively quick fix things. So not a problem to have those, but we want to be mindful of what it means to take action, and how to take action in a way that's empowering and helpful to the person rather than disempowering to the person. So, I'm the expert. I need to share with you. I'm the helper. I need to help you. I'm going to fix this situation. Um, I'm going to get the care team to fix this situation. So what are the implications of this? And are we working in partnership with that resident to better understand them and to work with them, or are we doing stuff to them or working on them in our orientation as fixer? Is it an empowering or disempowering orientation to that person? Here's another poll for you. Which of these four are you most likely to do as the fixer? If you're in that fixer role, so maybe we can do a quick, have you select one of these. Which one is more likely for you? Which one is most likely? So I think we have another poll that Derek can share on this one. Try to quick fix something by providing information uh, to the resident, or information to the care team members, or support to the resident, or by providing support to information to the care team. So let's see, which one of these do you think is the most likely? If you had a strong desire to be the fixer, um, which one might you do? And it's not to say that these are bad things to do. They might be perfectly appropriate, but they also might be something that you might feel compelled to do based on your own reactions rather than your thoughtful care planning. Um, which one do you think is more common for you? If you're going to do that quick fix, like, I got to make this go away, I got to do it right now. Do you tell people what to do, info to the resident? Do you talk to the care team? What's most common for you? So we'll see which one is something that might occur for you. And does it tend to be more informational or more support? Some of us tend to be lecturers, where we see something that's not going the way it's supposed to. We tend to want to tell people stuff, information. Some of us are more emotionally supportive in those environments and try to create some kind of a nurturing or warm environment to try to help that person. So let's see what we get for results on this one. So the most common one is to try to quick fix something by providing support to the resident. So directly engaging, and that's a strong item in terms of its dominance of these four items, which is not too surprising given the work environments in which you find yourselves and the kinds of values and orientation to the world that people who work in your healthcare environments tend to have, right? Tend to be people who are nurturing and caring, and who will be more likely to reach out to support others. So we have to see that as a powerful strength. We also have to see it as a potential vulnerability if we're engaged in quick fixing that could be disempowering of the individual. So we want to be mindful about that as a potential stressor for, or if it might diminish your ability to be impactful with with your work if you are quick fixing and maybe not honoring or allowing the person to work through or talk through what they might need to explore. So kind of be mindful of that because we see it's a dominant presentation for many of you. So thanks for that feedback. All right. So let's think about this for one more little quick moment. We're going to take one more little moment and have you interact with each other. Actually, you know what I might do? I'm going to leave this on screen. We're not going to do a breakout. I'm going to ask you to give me some chat responses to this. So let's think about this. Imagine that you're a patient. So think about what it's like when someone may be telling you stuff, who's the one who's the knower. Think about your own healthcare encounters with healthcare providers. So imagine that you're the patient and you've gone to see your healthcare provider and you have some symptoms that you think you understand based on past experiences. Your provider doesn't ask you anything about your experience, and they diagnose you, and they tell you what they think is happening. So what do you do? Do you tend to share how you understand it, and maybe it's a little different from what they're saying? And how do you tend to feel about your level of participation if you're not being asked to support what's going on or to share your experience? Many of us have had experiences like this where a healthcare provider doesn't ask us what we think is happening or what we know about it. They just do their exam and then they tell us what's going on, but they don't ask us at all. What's that like for you? And I'm curious if you want to go ahead and share that in the chat, what that experience feels like for you if you don't, if you're not part of that conversation. Does that feel okay? Hey, they're the experts. They know. That's why I'm here. I want them to do that. Or I feel kind of like I should be included. How do you respond to those situations as a receiver of healthcare? Anybody want to share that in the chat? Or you could also unmute if you want to. I'm happy to hear someone's voice as well. So from Sarah, I think it's important to find a provider where you have a relationship that you are a participant. So a partnership, a participant. Sharing experience is valuable. I always share and allow residents and families to share. Yeah. Anna, while I value and respect my medical provider's opinion, I also have the voice, feel that voicing my concerns is helpful. I tend to alert the provider about my clinical background and share my info. Uh, it's important to have a person's experience directly. Feels rushed and they're missing crucial details, and then I need to go home and Google things, right? You didn't have that interaction, so you feel like you didn't get what you needed. It happened to me with a doctor who was looking more at the computer and not me. I changed providers. Okay, so that kind of was a strong message. Thank you for that, Darlene. A strong message that I don't feel like I'm being seen as a person. I feel like I'm being sort of that they don't really aren't interactive with me. Um, so a pretty strong consensus here of your opinions, which is not surprising. I think this is the more contemporary attitude toward care, right? That it should be a partnership. Each of you is a thoughtful expert on your own experiences. Right? And so you're a critical provider of information about your own experiences. And so if that's left out, what we have then is a care environment that's limiting its ability to know by not asking a really important source, the best source, the expert. Just like when we're talking about pediatric healthcare and we just examine children but don't ask their caregivers what the caregivers experience is, because those caregivers know more about the child than anyone could, who was a care provider could know, who was a healthcare provider could know. So similarly here, um, um, so Melissa said, as a healthcare professional, yes, but if you're not a part of that world, you would not advocate for yourself, right? Um, so how do we try to find ways to be those self-advocates? And then think about this translation. Andrea's saying trying to prepare questions, so you're not rushed. I do the same thing. I know sometimes I have certain things that I need to talk to a care provider about, and it's easy for me to lose track, partly because I try to be a good compliant patient and do the process the way they want me to. And then the appointment's over and I go, oh, I forgot to ask that thing. So I try to have a note for myself of some very clear prepped questions so that I make sure that I get the information that's important to me. Might not be important to them, but it's important to me. So I do the same thing that Andrea is describing. I think that's usually helpful. So translate that personal experience into the experience with the residents, with the individuals you're serving and supporting. What's it like for them? Does the environment create the opportunity for them to do what we just heard many of you thoughtfully describe as critical to you? Does your care environment where you're delivering services create those same courtesies, those same respects, those same acknowledgments of the resident, of the person receiving the services as the expert of their own experience? Nobody knows their experience the way they know their experience. And so we have to find ways to ask. And that's where we get back to those key questions, right? So thinking about this relationship dynamic, right? How do we really kind of shift? Some of our language is really old. We keep talking about partners, but a lot of our language where we have providers of services and recipients of services, it's a pretty interesting dynamic. There's no mutuality, there's no collaboration in that language. There's one person giving it and the other one receiving it, right? There's an actor and a receiver, there's an active party and a passive party, but we're all very aware, based on everything you all have been saying, of the need for that to not be an active and passive, that it needs to be two active parties, and that the care provider's job when people are distressed in particular is to elicit their active participation, to engage them, to use these tools, these centering tools, these grounding tools, these ORS tools, these open questions, open-ended questions that will elicit and engage and activate that person's participation, so that you can then become partners in wellness. And as we kind of go back to our original orientation, if we do that, we can then move forward with a really strong and healthy relationship. We do have a few moments. If we have any questions, I will remind you that we're at part 5 today of 6. We have one more in our series of 6 sessions. And we do have technical assistance available through the Center of Excellence. If there's any individual organizational level support, technical assistance, or coaching that you feel would be helpful and useful to you, please do feel free to reach out to the Center of Excellence with regard to that need, and we can certainly do our best to support it. Do we have any other comments, questions as we wind down, either unmuting or using the chat to share them? We have a minute or two before we wrap things up with our final process.